Do you think the liberals will be punished now for maybe the way they dealt with healthcare when they were in
I think
power?
so, and Madame Englert is not.
She's not catching you.
No. No. Not even my husband, not even my kids. No. It's sad. We always vote liberal here. We will see what will happen. It's very important. Especially my husband, he had a heart attack in the States, so we brought him to Quebec.
Because you heard François Legault's promise the last election. That
I know,
everyone
my husband is still on the waiting list for 5 years now
for a doctor.
for a doctor. And my daughter, she got one, they called her last week after 7 years. We cannot say it's Legault problem, but it's the health problem in general.
There's no clinics. There's just no, like, it's so hard to book an appointment in a clinic. There's no resources for children and for adults, actually. I'm lucky enough to have a doctor, but if you don't have a doctor, it's impossible to get one. So that to me is incredibly important. And even if you do, to actually get a spot at last minute emergency is really, really difficult. Well, I'm not really liking the CAC in the way that they're dealing with they dealt with the healthcare industry, the healthcare issues.
Right.
I think for me, what I would find really important is to kind of deconstruct the entire healthcare system and rebuild it and really find the source of the issue. It's really about the core of the issue and the treatment of the healthcare worker.
The pandemic has taught us a lot of different things, and being a daycare owner, it has put a lot of strain on us. And I feel that things have to work differently. I think parents of the children at the daycare need to know that when they need a doctor, and a lot don't even have a pediatrician, they don't have a family doctor, and so we're requesting notes, and it's very difficult. The parents are telling me, I can't get a doctor's note, I have no doctor. And so we're requesting a note for the child to come back to daycare to make sure that everybody else stays healthy and safe. But they're outright saying, I'm going to have to go to the hospital and wait a day, 2 days before I get seen by a doctor. This party that I would like to vote for is very in tune with the medical and is going to continue to fight for what they believe is right, and making and understanding that childcare is an issue right now, healthcare is an issue right now, and our environment is an issue right now.
We went yesterday to the ER for my son, and I think he was classified priority 2 or 3. I don't get it. So he wasn't able to see a doctor right away because there was a lot of people. And while I was waiting, and I went on Bonjour Santé, and I got an appointment with his family doctor, luckily. So we left the ER and we waited for our appointment. I don't know if we have to bring more people from other countries. There's a lot of doctors. They're doctors from other countries, and because I don't know, they call it there aspirin, and they call it here Tylenol. They can't work. It doesn't make sense to tell a doctor that spending I don't know how many years of his life studying, coming back here, get to university for another 4 years, and then go through the barrel of doctors and maybe get approved or not if he could practice. Doesn't make any freaking sense to me. So we have doctors that they're driving Uber, but because they're from another country, sorry, you can't practice. But we're missing doctors, and most of the doctors, they go into the state because they're paid more. And if we pay the doctors more, people, they're gonna be like, we pay them because they're what we need them. We need a health. If we want it to be free, we have to compromise on others. I don't know. It's a give and take. You can't be having it for free and say why we're giving them more. I had to beg my family doctor to take my kids. So because the pediatrician went on retirement. He was so old. He worked all the way to the end. And then my mom found me my family doctor, because she took my mom, and my mom, she's like, I don't get it. You're a family doctor. You have to take all my family. And she felt bad, and she took all of us, me and my brother and my sister, and then she took over my kids. She said, I don't have a room, but put yourself on the system, and as soon as I could go get them, I will go get them.